Lawmakers held a short session yesterday with morning deliberations and afternoon voting. During voting, they overrode two bills, one of which now requires that GovGuam pick the least expensive health insurance contract. The override drew strong criticism from Governor Eddie Calvo.
Speaker B.J. Cruz urged his fellow lawmakers yesterday to override the governor's veto of Bill 3-34. The measure would require that GovGuam go with the most affordable health insurance plan, even if it means going with an exclusive plan that doesn't allow GovGuam employees to choose between providers. Speaker Cruz said that if GovGuam had gone with the most affordable plan, it would have saved $20 million last fiscal year.
We've got to go with the most economical. We've got to save $20 million. We've got to save $20 million to either fund DOE, we've got to save $20 million to either fund GMH, or we've got to save $20 million to try to fund the various agencies that many of you have under your purview.
The speaker was referring to data provided by the GovGuam Health Insurance Negotiating Team from FY 2014 to FY 2018. In FY 2014, the team found that an exclusive contract would have saved $18.7 million from the contract for FY 2013, which was $74.5 million. In FY15, Take Care Insurance was scored as the highest ranked insurer offering an exclusive contract. This exclusive contract would have saved $6.2 million from the FY14 contract of $73.5 million. In FY16, Take Care was again scored as the best exclusive contract, which would have saved $7.6 million from FY15's cost of $79.5 million. In FY17, Take Care was again scored as the highest ranked exclusive contract. This contract would have saved $20 million from the FY16 cost of $93.1 million. In FY18, GovGuam again ranked Take Care as the highest exclusive contract offerer. This contract would have saved $15.23 million from FY17's contract, which now costs $95.39 million. Guam law requires that the negotiating team submit the most economical and beneficial exclusive health insurance proposal and up to 3 non-exclusive proposals. It is then up to Lieutenant Governor Ray Tenorio to decide which contract to pick. This in order to avoid a conflict of interest with Governor Eddie Calvo, as his family owns insurance provider Calvo Select Care. Tenorio has opted to go with the non-exclusive contract over the last 5 years. And over the last 5 years, the exclusive contract would have saved GovGuam, its employees, and retirees a total of about $67.73 million in health insurance premiums. Ultimately, the veto of Bill 3 was overridden with a vote of 11-4. Senators Will Castro, Tommy Morrison, Luis Muña, and Dennis Rodriguez Jr. voted no. Now that the bill has been overridden, it means that GovGuam is now required to pick the least expensive health insurance option. The governor's office responded with a release criticizing the override for taking choice away from GovGuam employees, retirees, and their families. The administration says the governor vetoed the bill last year because if it had been passed into law, quote, the people who rely on GovGuam health insurance would not have been able to go to the Seventh-day Adventist Clinic or the Guam Regional Medical Center. Take Care Insurance currently does not have an agreement in place with the SDA Clinic or the Guam Regional Medical Center. The governor's office says that while Speaker Cruz touted the $20 million this contract would have saved GovGuam, quote, that savings could be artificial. In negotiations last year, one of the bidders didn't have a contract with the Guam Regional Medical Center or the Seventh-day Adventist Clinic. The governor's office says the current health insurance contract allows GovGuam employees to choose the insurance company that offers the services and providers that best fits their family's needs.
For the complete list of bills voted on during session by the legislature, log on to thepacificnewscenter.com.